Caesarean section rates in Australia have doubled in the last 20 years or so and currently sit at around 30%. Now, new evidence shows that midwives could help to lower the number of caesareans, and experts think that it's all because of the relationship new mothers build with their midwife.
We're not really sure what the magic is, but what we think it is, and we're studying that now here at the university in a big ethnographic study, is it's the relationship. It's about a partnership and it's about trust.
A Victorian study has found that women who are cared for by a single midwife throughout their pregnancy are less likely to need a caesarean section. The study compared the caesarean rates of women who had one-on-one care with a primary midwife with other women who had standard care from a range of midwives, obstetricians and GPs. It was published in the British Journal of Obstetrics and Gynecology in July. Obstetrician-gynecologist Dr. Andrew Pesher said these results could be because a woman who has a rotation of doctors and midwives throughout her labour will be exposed to multiple ideas on how she should proceed.
The weakest link in the chain is the one that determines it. You can have 9 midwives that all say you can have a normal delivery, but if one says, look, I think you need a Caesar, or if that's what the doctor says, you only need 1 out of 10 to say that, and that's what's going to happen.
Associate Professor of Midwifery, Hannah Darlin, said these findings are significant because Australian caesarean rates are currently too high.
Caesarean section rate should be over 5% at least, probably sitting around 10 to 15. The World Health Organization is still saying that's ideal. We've got the Netherlands, which has a 15% caesarean section rate. We've got Scandinavia with around a 20% caesarean section rate, and here we sit with 1 in 3 women in Australia having major abdominal surgery. Once you've had a caesarean in this country, you've got about an 85% chance of having another one. Once you have 2 scars on your uterus, now the complications start to increase. It's more likely your placenta will grow into the scar and you'll need to lose your whole uterus and not be able to have any more children. More likely for the placenta to grow abnormally low, which means, again, big risk of bleeding and complications. We're now seeing a whole lot of epidemiological and epigenetic studies which are showing us that the way we're born is reshaping us immunologically. So type 1 diabetes is 25% increased in babies born by caesarean. Asthma, obesity, multiple sclerosis has just come out, a whole bunch of different types of cancers.
New mum Trudy Nichols said the standard care options were daunting and didn't suit her.
I was kind of just trolling the internet and I kind of stumbled over it and I just went, this is exactly what I'm after. I'm after continuity of care. I'm after knowing that that person is going to be there for me, not only throughout my pregnancy, but on the day.
Trudy said there were some big advantages to being cared for by a midwife.
Our appointments were at least an hour long each time, and whereas with an obstetrician or through the public system, as I understand it, they're significantly shorter. So I'm not sure that you can be in a position where you don't know what to ask because you've never done it before. You've got no prior experience there. So you don't necessarily know what to ask. And if you're reading, material that's contradicting itself, and which there's a lot of material out there that contradicts itself, it's good to have that one source of truth, I suppose, let's call it.
Trudy also said her experiences with her midwife were very collaborative.
Melissa encouraged us to read a lot, watch a lot of DVDs and things like that, which I must say at the beginning I was completely like, well, what am I doing here? You're supposed to be my reference point. But she, I guess, enabled me to come around to the fact that it was a joint exercise. Like, she couldn't do it for me. She wasn't the one having the child. That was me, and it was my job to learn about what I needed to do as much as it was for her to give me the information.
Dr. Pesha said there needed to be a shift towards more collaborative care arrangements for pregnant women, with more one-on-one care from midwives.
Unfortunately, to my view, the public maternity system provides no continuity of care for women who have to see doctors, and it's only now starting to provide continuity of care models for women to see midwives.
Miss Darlin said that the reduced caesarean rate was fantastic, but the study found there were other medical advantages to one-on-one midwifery care as well.
The outcomes were stunning. 22% reduction in caesarean section with no difference in perinatal mortality, which is numbers of babies dying. But even more significantly, a 37% reduction in babies going to neonatal intensive care, an increase in breastfeeding, reduction in epidural, reduction in episiotomy, and greater satisfaction. So on every single level, women did better and babies did better under continuity of midwifery care.
The biggest advantage of one-on-one midwifery care, said Miss Darlin, is that a midwife can help mums to understand that labour is powerful and triumphant, rather than a fearful and damaging experience.
When we see fear during labour, what we see is adrenaline produced. And what adrenaline does is that it affects our oxytocin, which is essential for contractions. It also affects our endorphins, which is essential for us to feel good, feel immersed, feel spaced out. So we have more painful contractions, we have slower labours. So if you can get rid of fear by building trust, you take away the brakes. You take the brakes off birth, and birth flows beautifully.
Emma Rennie, reporting for the M Word.